Good morning. Today is Friday, June 5th. My name is John Kinseth. I'm the Deputy City Manager here in the City of Decatur. Start out today by talking about the number of COVID cases. The number of COVID cases here in Macon County as of yesterday are 200 cases. We have had 20 deaths and we currently have one person hospitalized. As you can see, our hospital system has capacity. Many of them have returned to doing elective surgeries and providing access to more or less all of the medical functions that were pre-COVID as they were then. So if you have been waiting for some type of medical issue that you need covered, now's the time to go into the hospital and get those things, hospital, dentist, etc., and get those things taken care of. The reason that the number of hospitalizations matter is that is one of the key health metrics that will determine whether we move from phase 3 to phase 4 by the end of June. The rate of hospitalizations, the rate of tests, and the rate of positives in those tests are the metrics that will ultimately determine whether we move from phase 3 to phase 4 on June 27th, I believe. So we're doing well as far as that goes. Please continue to do your social distancing, continue to keep things in mind, wear the face covering, and we can hopefully have good metrics and continue to move along through the 5-phase reopening Illinois plan. The city is preparing to reopen the Civic Center to the public. At this time, we are anticipating a June 15th reopening to the public. The Lake Patrol office is open now, and we have increased our lake patrol for the lake, as we know that many people are out using Lake Decatur and enjoying that great amenity that we have here in our community. As a reminder, the city had previously a parking ticket amnesty. Essentially, this was your opportunity to pay old tickets without the late penalties and fees, etc. That is drawing to a close. June 15th is the city did extend it during the COVID crisis beyond the original 90 days, but we do have to bring it to a close, and that date is drawing near. June 15th is the final date to get those parking tickets paid, or at least have a payment arrangement in place so that you don't increase the amount that you have to pay. So please, if you have one of those outstanding parking tickets, contact staff. We can talk you through what your options are so you can put that behind you. The city will also begin to resume parking enforcement in downtown in the on-street parking and parking lots, etc. We will start that parking enforcement as of Monday, but we will likely not issue tickets until June 15th. So we're going to give you some time to get some warnings and otherwise just kind of be gently nudged back to following the parking ordinances that are in place. Also want to talk about these videos. So the city did commit to doing these 3 times a week videos during the COVID crisis. As this crisis is currently drawing to a close, at least as we knew it previously, the stay-at-home orders have been lifted. We moved from phase 2 to phase 3. We hope and anticipate moving from phase 3 to phase 4 later in June, as mentioned. And so we will likely start to reduce the number of these videos that we are producing. I believe the plan at this point is that we will still continue to do these videos once a week on Wednesdays, and they will move from just covering COVID issues, but ultimately cover the issues of our community on that particular week. We will likely use these videos to highlight programs and projects that the city staff and the city council are working on. So you'll likely hear about agenda items that are coming for future city council meetings. You'll likely hear about different relief measures that the city is considering and are available to either our residents or to our businesses. But those will be the theme of the videos moving forward because we do want to continue to do these videos for those that have found them to be helpful. We welcome your feedback. on the videos and tell us what your thoughts are, how we can improve them, so that we can really make this about you and the best way to get information to you. And so that's something to look forward to that will be starting as early as next week. Again, thank you for all that you do, and together we will get through this. Thank you.
Hello, I'm Dr. Mark Scott. I'm the Medical Director of the SMU Center for Family Medicine in Decatur. I'm happy to report some recent good news about COVID-19 in the community and in Illinois. We are currently seeing a downward trend in the number of new cases, as well as the number of hospitalizations and deaths, both in the community and in the state. So I'd like to take a little bit of time today to review just how COVID-19 is transmitted once again, in the hopes that we can continue to see improvement in our community. So, as you'll remember, the COVID-19 virus is spread by respiratory droplets. Respiratory droplets are expelled from people's mouths just simply by talking, laughing, singing, but also by coughing and sneezing. Sometimes those droplets can be expelled long distances, particularly with coughing and sneezing, and that's why it's recommended that you cover your coughs and sneezes to eliminate that risk. Wearing a face mask is something that's been recommended for the general public for some time, and that also helps to reduce the amount of respiratory droplets that people expel into their environment. This is also very important because of the risk of COVID-19 infection from people who do not even know they're infected. There's an asymptomatic period that many people have for up to 48 hours before symptoms even start. So again, the use of face masks is very important, and we should continue to do so. One of the things that has happened in the community recently is we've had some mass gatherings and rallies and some protests. And in some of those instances, it has been difficult for people to maintain proper social distancing or even wearing of masks in those situations. On Thursday, the director of the Illinois Department of Public Health recommended that if you did participate in one of these mass gatherings, that you be tested for COVID-19 in order to try to reduce the risk of spread throughout the community. If you did participate, it is recommended to be tested for COVID-19 sometime around 5 to 7 days after your participation, or immediately if you start to develop symptoms. Now, the main way that COVID-19 is transmitted, again, is through respiratory droplets. But there's also the possibility of spreading the virus through touching of contaminated surfaces and then touching your nose, your mouth, or your eyes. It is not known for sure how long the COVID-19 may last on certain surfaces, but is felt to behave similar to other coronaviruses. For instance, other coronaviruses are known to last on surfaces such as metal and wood and glasses, plates, and ceramics for up to 5 days. They can last up to 4 days on wood products, up to 3 days on plastics, up to a day on cardboard, up to 8 hours on aluminum cans. And it is unknown how long that the coronavirus lasts on certain fabrics because they're all different. On clothing, on shoes, and on skin and hair. So the important message in this is that if you touch surfaces frequently, you should avoid touching your nose, your mouth, your eyes, and you should perform hand hygiene frequently, which is either washing your hands with soap and water for 20 seconds or using a hand sanitizer that contains at least 60% alcohol. So, food packaging is another frequently asked question. So far there have been no reports of anyone catching the virus from handling food packaging or from consuming food. So the risk of contracting the virus from those things appears to be very low. It seems that the people that are at highest risk of contracting the virus from touching surfaces are really those who are taking care of persons who already are infected, such as in a home environment where there is someone who has COVID-19, or healthcare workers in a hospital or clinical setting. So it's important to clean and disinfect commonly touched surfaces on a regular basis, such as countertops, tables, doorknobs, phones, keyboards, remote controls, and toilets. You can make a simple bleach solution at home with 4 teaspoons of bleach per quart of water, and you just wipe it on the surface, and it needs to remain for at least a minute. In addition, there are EPA recommended sanitizers and cleaners that you can purchase that can be used that are active against COVID-19. And if you go to the CDC website, they have a list of these products and whether they're effective against the virus. Wash your hands again for at least 20 seconds, or use a hand sanitizer with 60% alcohol after touching these surfaces. The hot weather also seems to be helping, as the virus does not seem to live as long in hotter temperatures or in more humid environments. So as we get into the warmer parts of summer and the more humid parts of summer, hopefully that will also decrease the rate of transmission. There's currently no evidence that animals or pets have ever transmitted the virus to humans, but it is possible and has been seen that humans have transmitted it to their pets. Cats seem to be more susceptible than dogs. It's very important at this time to continue to try to keep your pets and animals indoors and away from people that are strangers or are not members of their household, just to try to protect them. I hope you found this information and video helpful, and take care and stay safe. Thank you.